It is the voice of Indiana County, WCCS, AM 1160 and 101.1 FM. Dr. Nazneen Billimoria joins us in the studio again. Good morning.
Good morning, Todd. How are you?
Wonderful. You?
Excellent.
We're talking about breast cancer awareness, breast cancer treatments and options. I want to tell you this story, though. I want to start out with this story. This happened in England. A woman found out she had breast cancer when she went into a thermal imaging room at a museum, and she noticed that her left breast was discolored. You go in there, and it takes a heat stamp of your entire body. And then people go in, and they wave their arms around. It's just like a funhouse type of thing. But she took notice of the fact that her left breast was a different color, and nobody else in the room had that color.
Yeah.
So the breast cancer that she had was actually showing off a different heat stamp than the rest of her body.
Wow.
She was smart enough. She took a photo of it with her phone and then took it to her doctor. He got her in, and they started treating her. They found out she had breast cancer.
Wow.
The point is, there are much easier ways to find out and less chancy ways to find out that you have breast cancer, aren't there?
Absolutely, Todd. Absolutely. We've mentioned this before on the show that we have 3D mammography here in Indiana and also at Blairsville. And actually, very imminently, we're going to be getting our second 3D mammography machine here in Indiana. So, to all the women out there, come on in, get your mammograms. It's walk-in Mondays in Indiana and walk-in Wednesdays at Blairsville. I myself got my first mammogram earlier this month. I've joined the club of women who need to get these annually. And, I see how women say it's not the most comfortable exam, but hey, it beats having a colonoscopy every year, huh?
And it also beats not finding out that you have breast cancer, which would be the most tragic result.
Yes.
All right. Yeah. So you went through that process.
I did.
And millions of women are doing that now. In fact, it's become such a norm here at IRMC that they're adding the second 3D MRI or 3D mammogram machine at main campus. So, they're getting the message.
Yes, they absolutely are. In the last year, we've had so many new additions to our breast cancer program, a lot due to Dr. Clark here. We've started doing MRIs at IRMC, which we started in about January, February, earlier this year. MRIs are an adjunct to women who require any high-risk screening or women with breast cancer who need some additional imaging to take a look and see how truly advanced the cancer is. It is definitely not a replacement for mammograms. It is, as I say, it's just an adjunct to it.
It's another tool in the toolbox.
Exactly.
Very good. So when the diagnosis comes, breast cancer, there are ways to treat it, of course. One of the ways in which you are directly involved is in surgery.
Yeah.
Let's talk about those surgical options.
Okay. Well, when I see a woman for breast cancer, I always say, the treatment of breast cancer involves some combination of surgery, chemotherapy, and radiation. Usually surgery is always involved. Usually it comes up front first, and then the other things come behind it. Sometimes that order is a little bit flipped. If women have an advanced breast cancer, then they'll maybe go through chemotherapy first, and then surgery comes second. But nowadays, with all the research that has been done over the last, 20, 30 years in breast cancer, most women, by the time we diagnose it, and because we're diagnosing it so early, a lot of women have the option of what we call breast conservation versus doing a full mastectomy. And what breast conservation means is that we are only removing the part of the breast that has the breast cancer. We are preserving the remainder of the breast, and we're only removing a small lump, so the woman has really no deformity. And, she doesn't have to go through a mastectomy to have equivalent results. Typically, a segmental mastectomy or a lumpectomy, which is what I talk about with breast conservation, typically that has to be followed by radiation once surgery is complete. The reason for the radiation is to reduce the risk of any local recurrence. So a lumpectomy with radiation is equivalent in outcomes to a mastectomy. And the other option we also now have is for women who just don't want to have breast conservation. They feel better having a mastectomy. And that's perfectly fine. But the option that they do have is immediate reconstruction. And we have that available at IRMC now. Dr. Francis Johns is the plastic surgeon who does a lot of that work for us, and he's fabulous. The results have been just excellent, and women are very happy.
When Dr. Clark was here earlier this month, when Dr. Remadini was here with us last week, both of them talked about the conferences, the UPMC Hillman folks getting together with the IRMC folks, and how each case has really gone over in depth so that you can determine what are the options for care, what are the surgical options, what other options are there. That's a very important meeting, isn't it?
It really is, because, that meeting involves not only just the surgeons and the oncologists, but you have the radiation oncologists, you have the medical doctors, and you have other specialists all present at the conference. And they all bring a different perspective to treatment. And so sometimes after that conference, it does slightly alter how we treat our patients or what we feel is best. So it's really, really a crucial conference that is very beneficial. It's beneficial to us. It's beneficial more to our patients.
Dr. Nazneen Billimoria is with us this morning here on Indiana in the Morning. We're talking about breast cancer diagnosis, early detection, and, of course, the options that come for treatment afterwards. Talk, if you would, for a while about the emotional aspect of a woman who is facing that surgery. It has to be very, very frightening for them.
It is, Todd. A lot of women, they feel, this is not going to happen to me. And it does. And the diagnosis does come, it is a bit of a shock to the system. And we understand that. In our program, typically a woman is given the diagnosis usually by the radiologist who has done the biopsy, because that's their first stop. They come in, they get their mammogram. If there's something abnormal seen, they will come back for a return, what we call a diagnostic mammogram, where they get a closer look at the area. And then if the radiologist still feels that the area looks suspicious, they go ahead and schedule a biopsy. And then most of the times these biopsies do come back benign, but sometimes they come back breast cancer. So the woman comes back for her results, and she's given that result by one of our radiologists. And then if it is a breast cancer diagnosis, she's immediately plugged into our system and gets to meet our nurse navigator, who's Dina Deal, who is absolutely excellent. And Dina is responsible for then scheduling the woman with the other specialists. So that is surgery. So myself or Dr. Clark, oncology, and then radiation oncology. But they're already so overwhelmed by the diagnosis that I think in doing this, it takes off some of the worry, because they don't have to worry, where do I make my next appointment? Where do I go next? Who do I see? Who do I talk to? Yeah. So we kind of try and take that aspect of their emotional worry out of the equation. We kind of set everything up for them. We say, here are the appointments, here are the times, just go to these, and I think the other thing is it's really important for family support. Yeah. I think that's the biggest part. Most of the time when I see women in the office, most of them come with family members. And if they happen to be alone, I'm always asking them, do you have a family member waiting out there for you? And have them come into the room for the discussion. So
that's a pretty important structure, isn't it?
Yeah, absolutely.
I got a call from a guy who actually left a message on my machine and said that one of the things that we need to talk about is the fact that breast cancer is not limited to women. It's rare in men, but it does occur. And in fact, he's been diagnosed with it. Yes,
absolutely. It is a very rare diagnosis in male patients. And actually, I very recently had a male patient with breast cancer. Mm-hmm. He came in. Was just having some symptoms, and we went ahead and, it just wasn't normal. So we said, let's go ahead and do a biopsy. and lo and behold, the biopsy came back positive.
Is this treatment going to be the same? Follow the same general course?
Yes, it does. And the lucky thing for my patient was that it was not an invasive breast cancer, but it was breast cancer all the same. But yes, the treatment does follow the same as women. It's just that we don't see it that often in men. My former partner, Dr. Mark Boyque, had been in practice 35 years. I think in his long practice, I think he had maybe one, I know he had one, maybe two male patients with breast cancer. So it is not a common thing. Usually by the time it's found in men, it's more advanced. Oftentimes men just don't think about it or don't go to the doctor because of that, because they're a man, they're not going to have breast cancer. But it's very possible. But the treatment's usually very similar. Most men are going to have a mastectomy because there's not typically much breast tissue there anyway. So typically men are going to have a mastectomy.
Doctor, talking with Dr. Nazneen Billimoria this morning, the partnership with Hillman had been announced when we talked about this last October and had already begun. But talk, if you would, about how that has developed and what an advantage it is here for Indiana.
Well, everyone, when they think of Indiana as a small hospital, they say, oh, well, are you going to have the latest and greatest to offer us? Oh, maybe we should go down to Pittsburgh so that we should get the latest treatment that is available. Well, they don't have to do that anymore because our oncologists are affiliated with UPMC Hillman, and they're right here in our backyard. So if there are any new clinical trials or new agents that they're treating breast cancer patients with, that's available to them here. The surgery that you have for breast cancer is no different whether you stay here or whether you go down to McGee or, the Hillman Cancer Center. More of the advancements are made in the way you treat it after. Chemotherapy, doing clinical trials, the reason we have breast conservation now is because back in the day they did clinical trials. They compared women with only a lumpectomy and radiation to women who had mastectomies, and then they followed these women for a number of years to see whether there was any difference. And that's how today we know that there isn't for most breast cancers, and that's why we have those options. So it's important for women to know out there that even though we are a small town, Indiana, we do have the latest and greatest because of our affiliation with them. They have access to all the clinical trials that are available at Hillman, and they don't have to go down to Pittsburgh for that.
Absolutely. She's Dr. Nazneen Billimoria. Ladies, get your mammograms. Walk-ins on Monday at IRMC Main.
Yep.
And at IRMC at Chestnut, walk-ins on Wednesday.
Yep.
And call any other time. If those days don't suit you, call another time. They'll set you up.
Exactly.
Set you in. Thanks for being with us this morning. Appreciate it.
Thank you, Todd.
It is the voice of Indiana County, WCCS, AM 1160 and 101.1 FM.